definitely there must be a multidisciplinary approach in medicine. There is no doubt about that. The objection here is not about the Ayurvedic system. We have, as modern medicine practitioners, we have profound respect for Ayurveda physicians and their system of medicine, the highest level of respect. The problem comes in what I call good fences make good neighbors. See, you may have two good people living nearby. It's always good to have your own boundaries for all kinds of reasons. The fundamental difference is the modern medicine system is a standardized system worldwide. It's almost like, say, if you're an airline pilot, there is a fixed training module for being an airline pilot. You can't have a truck driver train him, give him a bridge course and make him an airline pilot. You can't do that. He might be able to fly if he's very smart. He may be able to fly, but it is just not the standard of care. We stick to the worldwide system of modern medicine.
Ayurveda
so
to
modern
truck
medicine
drivers
cannot be encroached upon by other systems of medicine. So people have to coexist with mutual respect. That is the point here.
Right. So when comparing traditional medicine like Ayurveda to truck drivers may not be the best analogy.
No, there is no comparison
because
here at all.
Traditional medicine is gazing. Right.
There is no comparison.
Because traditional medicine is gaining wider acceptability.
Yeah. There is no comparison to a truck driver at all.
Right. So traditional medicine.
Yeah. It's about standardization. I'm using an example for standardization. All right. So standardization has to be respected.
Traditional medicine is gaining wider acceptability globally. Now, China's Tu Youyou won the Nobel Prize in 2015 for an anti-malarial drug through traditional medicines. So it's an evolved science. Can't you give them some training and they can perhaps then perform surgeries? You disagree with that?
For anyone to perform surgery, there is an approved curriculum that starts with an MBBS course followed by a postgraduate training course in surgery. You can't perform operations if you complete the MBBS course. Generally not. It is unacceptable to do that, generally speaking. You have to complete a postgraduate course in surgery and then start at the bottom of the ladder, learn the surgical techniques and safe techniques, because a surgeon is like a pilot. You're flying and the patient trusts you for a safe landing. See, the patient is not going to know what kind of training you had or what college you went to or what your teachers were like. The patient gives you blind trust. Now, when you buy a car, for example, you're buying a car because you trust the manufacturer has done all the right things, all right? The same way, when a patient comes to a doctor for surgery, the patient puts a trust in the worldwide system of training of surgery, and that comes from an MBBS course followed by an approved postgraduate surgical course, which may be subspecialty wise, after an MS general surgery, DNB general surgery, followed by an MCH. Now, that is the approved system of surgery. And if somebody wishes to become a surgeon, they are welcome to do that.
Right. Let me go across to Dr. Navdeep Sharma, an Ayurveda expert. Dr. Sharma, can Ayurveda practitioners be trained surgeons? Can they be proficient, skilled surgeons with some training? Or as Dr. Jayadevan is saying, it's not possible without a proper course that the modern medicine practitioners follow.
See, since we have been into the examples of transportation sector, so I would like to say over here that it can be that a pilot who is driving an Indigo plane does not know how a pilot driving a Vistara plane is excellent in his field. So it's not about a truck driver and a pilot, but pilots of two different companies. Because at the end of the day, I would like to add something over here, that when a person who is a doctor in Ayurveda, he is designated to work as a surgeon, the person first has done a course of 4.5 years of BAMS, in which he is taught the allopathic pharmacology, the pathology, then surgery. These all are subjects in Ayurveda. An Ayurvedic doctor has to study both the things, the Ayurveda as well as the allopathic aspect, looking at the modern demands. Now after that is 1 year compulsory internship, where in colleges like Paprola, BHU, Udupi, Bangalore, there are so many surgical branches running so successfully. Again, after this, the doctor who has done BAMS, he is required to give a PG entrance test, which is really very tough with so limited seats. And once the doctors who are the best are selected across the country, they have to go a 3 years of PG program where they are given practical training for all those kinds of surgical procedures which have been allowed to them. I would also like to tell and add that after this, there is a 2 years of PhD program for them, which is done by many doctors, and also there is senior residentship, which is the same as allopathic system. So in no way there is any cut short for any Ayurvedic doctor having to do the surgery. And this is something which is really confusing for everyone.
Is it as extensive and in-depth as the course that the modern medicine practitioners have to go through? Is it as extensive?
Yes, definitely. And the reason being, I will simply tell you, see, the number of procedures that have been allowed by our government now are 37 in Shalakya, 20 procedures in Shalakya and 37 in Shalya, 11 in eye, and 7 in ENT and 2 in dental. And believe me, all the doctors who are practicing it's after their PG that they are allowed to practice in that particular surgery, and the procedures which have been allowed, they are thoroughly studied. A lot of hard work is put in, and to be honest, there are so many doctors around India who are from Ayurvedic fraternity and who are doing these surgeries with great success.
All right, gentlemen, let me take my argument a step further. Dr. Jayadevan, to you now. Do you see these two streams as complementary sciences? The new education policy gives students the liberty to choose subjects across streams. I don't think that applies to medicine, but in other streams, you can choose subjects across streams. So, a science student can choose an art stream, a math student can probably study with psychology, a biology student can study with English literature, so it gives them that kind of flexibility. Should we have that kind of flexibility in medicine also? While a modern medicine student can maybe choose an Ayurveda subject as well. You can mix and match. Is that something that is desirable in your opinion?
That's a great question. As I said before, this is a question of standardization. As I mentioned, the examples that were quoted were referring to standardization, not about driving any particular vehicle here. I hope Dr. Sharma understands the concept of standardization. All right, it's precisely what I was talking about. If you want to perform surgery, there is a standardized procedure for performing surgery. You can't have somebody who has a little bit of knowledge of this and a little bit of knowledge of that suddenly start performing surgery, and that is completely, totally unacceptable against the worldwide system of medicine. India is trying to rise up to the level of other world nations, and sometimes we claim to be superior. We need to prove it. We need to prove with good scientific progress. Ayurveda system, as I mentioned, I have great respect for it. It follows a completely different philosophy, respect, system and beliefs that are passed down through generations, as I understand. And no modern medicine doctor will be allowed to prescribe any Ayurvedic doctor. I will completely oppose that because it is a system that has to be taught the way it is supposed to be taught. Likewise, I'll also expect the Ayurvedic system of medicine to also follow their system. And of course, different doctors can coexist. You can work in different clinics, and different systems work in different diseases can be treated by different doctors. But the point is, as I mentioned again, good fences make good neighbors.
Right. Dr. Sharma, let me come to you. I'd like to quote Einstein here, who said, it is not enough to teach a man a speciality. Through it, he may become a kind of useful machine, but not a harmoniously developed personality. So Einstein clearly was probably the greatest scientist of our times. Can a similar approach be followed in medicine, where you have the best of both streams being studied by students? a doctor who is reasonably proficient in both the streams. Is that a possibility?
Yeah, definitely. See, to be honest, when we talk about Ayurveda, see, the Indian Ayurveda has really evolved over the years. Now, in the current curriculum, whenever an Ayurvedic doctor is studying, for instance, if I am studying, I know that when a particular drug is going to be at the peak plasma level, what is the plasma protein binding of my particular herb, what are the phytochemicals of my herb, and along with that, not just the herb, if I am talking about an NSAID, if I am talking about any allopathic drug, if I am to give treatment to my patient in this modernized world, I need to be knowing all the latest antibiotics, everything, how they go in the body, how they are working. And to be honest, that is where the doctors, I personally feel that those doctors who have done PG, see, if I am into medicine, I am not into surgeries myself, but I am with the surgeons, the Ayurvedic surgeons, many of my friends are Ayurvedic surgeons, and I see them performing those activities really extraordinarily. And when we see about the set protocols, definitely the set protocols should never be defied. What I personally feel is that if there is something where we need to work in tandem, the allopathic doctors, they can put forward a particular set of protocols that, see, these are the protocols which need to be followed in a surgery. And if anyone, be it an Ayurvedic surgeon, be it an allopathic surgeon, if anyone is not following those set protocols, it is that person who is wrong, not a pathy who is wrong. See, we are in a country which is not amongst the richest of countries around the globe. And to be honest, when we are talking about Ayurvedic surgeons, in those small kind of surgeries, in those limited kind of surgeries, which have been allowed to those PG Ayurvedic doctors, it really will be very good for all those who cannot afford going for those expensive hospitals and those expensive setups. Already we are in a country where we do not have those many health professionals which are required, and at the end of the day, a person will neither be able to go to a good allopathic doctor nor to a good Ayurvedic doctor, and he or she will be ending in quackery. He will end up with quacks who will give fake guarantees, and the patient will suffer in life as well as in health.
All right, let me put this question to Dr. Jayadevan. Sir, let me put you in a spot. How do you see Ayurveda? Is it an evolved science as evolved as modern medicine, or do you feel that modern medicine is slightly superior, has an edge over Ayurveda?
Yeah, I don't agree with the word superior. I particularly dislike the word superior. I'm an egalitarian. I consider everybody equal unless they prove themselves inferior. All right. Now, the way I see it, it's my personal opinion. I do not give an opinion on a topic which I have not studied. I have not studied this Ayurvedic system, and I have the respect for it because it is a government-approved system. It is ancient, and I belong to the country where it was invented, so I have a lot of respect for it. Now, but I'm aware that self-correction is not part of its system because the knowledge has been passed down through generations, which is good. But the modern medicine system works on continuous self-correction. If you've noticed, in the last 200 years, almost no medicine that was used 200 years ago is being used now. And even as far as COVID-19 goes, the standard of care 2 months ago is no longer valid. So we, in the system of modern medicine, we work on a continuous process of self-correction, which is fundamentally not practiced, as far as I understand, in Ayurvedic system, because it's really an undiluted system, which is good for whatever it stands for. That's my opinion. But as I said, I have not trained it, and plus I know doctors who've done both systems. I know doctors who've done BAMS as well as MBBS, and they are eminent doctors who've done that, and that's hats off to them, because that is the way to practice both systems. If you really want to practice, if I want to practice Ayurveda, I'll have to go and join a BAMS course and start from scratch. There's no shortcut.
Right. All right. Last word to you, Dr. Navdeep Sharma. Ayurveda is now a recognized stream of medicine by the WHO. But as Dr. Jayadevan is saying, every stream has to work towards a process of self-correction. Can Ayurveda do that? Or has Ayurveda been doing that?
See, Ayurveda is already doing that. If I talk about myself, I have been representing my research papers in Middlesex University. I even represented some of my talks in British Parliament. And in US, I have been doing that. And not just me. See, I am a tiny droplet of the huge ocean of Ayurveda. There are thousands doctors like me. See, any pathy which stops evolving and which stops meeting the demand of the current day will die. And if Ayurveda has been able to survive these many, you can say, decades and years, it's only because it has been evolving. There are so many research works which have been done. And the biggest problem which we are facing right now, see, the biggest problem is that we know what allopathy is doing, and we have been studying allopathy. Unluckily, the allopathic doctors have not been studying Ayurveda. So today also they feel that Ayurveda is the same Ayurveda, but then the Ayurveda, it evolved from herbs to herbal extracts, from herbal extracts to phytochemicals, and from phytochemicals today, each and every phytochemical is also well studied. And that is why I would appreciate if the allopathic fraternity, they can go through the Ayurvedic courses, they can see the authenticity and the hard work which the PG doctors, the Ayurvedic surgeons, they are putting in. Then I feel they will have no questions left.
Right, sir.
They really need to understand what is today being done in Ayurveda.
Right, sir. So this debate will go on for a while now. The bigger question is, does medical science need a multidisciplinary approach? I think both the doctors here agree that they do. But still, should they be allowed, should Ayurveda practitioners be allowed to perform surgery? There is no consensus on a panel here. It's an evolving story, and we'll keep